After 60, your body does not process sugar the same way it did in your 40s or even your 50s. Metabolism naturally slows down, muscle mass decreases, insulin sensitivity can decline, and blood sugar levels may become more difficult to control. For many adults over 60, this is the stage of life when prediabetes or type 2 diabetes becomes a real concern. But what if one of the most powerful daily tools to support blood sugar balance is already sitting in your kitchen? Olive oil, especially extra virgin olive oil, has been used for centuries, yet modern science continues to reveal just how valuable it can be for metabolic health. Olive oil is not just another fat. It is rich in monounsaturated fatty acids, particularly oleic acid, along with powerful antioxidants such as polyphenols. These compounds work together to support the body in ways that are especially important after 60. Unlike refined vegetable oils that may promote inflammation, high-quality olive oil has anti-inflammatory properties that can help calm the chronic low-grade inflammation often seen in aging and metabolic disorders. One of the key issues in type 2 diabetes is insulin resistance. This means that the body's cells do not respond properly to insulin, the hormone responsible for moving glucose from the bloodstream into the cells. When cells become resistant, glucose remains in the blood, leading to elevated blood sugar levels. Research suggests that the monounsaturated fats in olive oil may help improve insulin sensitivity. When olive oil replaces saturated fats or highly processed oils in the diet, it can support better glucose control and more stable blood sugar levels throughout the day. Another important factor after 60 is postprandial blood sugar spikes. These are sharp increases in blood sugar after meals, especially meals rich in refined carbohydrates. Frequent spikes can damage blood vessels and increase the risk of complications related to diabetes. Adding extra virgin olive oil to meals may slow down the absorption of carbohydrates, leading to a more gradual rise in blood sugar. This effect can help reduce stress on the pancreas and support long-term metabolic health. Olive oil also plays a role in protecting the cardiovascular system, which is particularly important for people with diabetes. Adults over 60 with elevated blood sugar are at higher risk for heart disease, stroke, and high blood pressure. The antioxidants found in extra virgin olive oil help protect blood vessels from oxidative stress. Oleic acid can improve lipid profiles by reducing harmful LDL cholesterol oxidation while maintaining or even supporting beneficial HDL cholesterol levels. By improving vascular health, olive oil indirectly supports better glucose delivery and overall metabolic balance. Weight management is another key issue after 60. Many people assume that adding fat to the diet will automatically lead to weight gain. However, healthy fats such as those found in olive oil can actually promote satiety. When you feel full and satisfied after meals, you are less likely to snack on sugary or processed foods that destabilize blood sugar. Moderate use of olive oil within a balanced diet can support appetite control and reduce cravings, both of which are crucial for preventing and managing type 2 diabetes. The anti-inflammatory effects of olive oil deserve special attention. Chronic inflammation contributes to insulin resistance and the progression of diabetes. The polyphenols in extra virgin olive oil act as natural antioxidants, helping to neutralize free radicals and reduce inflammatory markers in the body. After 60, when oxidative stress naturally increases, these protective compounds can make a meaningful difference in long-term health outcomes. Gut health is another area where olive oil may offer benefits. A healthy gut microbiome plays an important role in regulating metabolism and blood sugar. Emerging evidence suggests that the polyphenols in olive oil may support beneficial gut bacteria. A balanced microbiome can improve insulin sensitivity and reduce systemic inflammation, creating a more favorable environment for blood sugar control. It is also important to understand that not all olive oils are equal. Extra virgin olive oil is the least processed form and retains the highest levels of antioxidants and polyphenols. Refined olive oils lose many of these beneficial compounds during processing. For adults over 60 who are concerned about diabetes, choosing high-quality extra virgin olive oil can maximize potential benefits. The oil should be stored in a dark bottle, kept away from heat and light, and consumed within a reasonable time to preserve its protective compounds. Incorporating olive oil into daily life does not require drastic changes. It can replace butter or margarine when cooking vegetables. It can be drizzled over salads, legumes, or whole grains. It can even be added to soups after cooking to enhance both flavor and nutritional value. The goal is not to consume large amounts, but to use it consistently as part of a balanced dietary pattern rich in vegetables, fiber, lean protein, and minimally processed carbohydrates. It is essential to remember that olive oil is not a cure for diabetes. It is a supportive tool. Blood sugar control after 60 also depends on physical activity, adequate sleep, stress management, and regular medical follow-up. However, when olive oil becomes part of a comprehensive lifestyle approach, it can amplify the positive effects of other healthy habits. Physical activity combined with a Mediterranean-style dietary pattern, which emphasizes olive oil, vegetable, fruits, legumes, fish, and whole grains, has been consistently associated with lower rates of type 2 diabetes. For older adults, even moderate activity such as daily walking can enhance insulin sensitivity. When paired with the anti-inflammatory and metabolic benefits of olive oil, the combined effect can be powerful. After 60, small daily choices accumulate. A spoonful of extra virgin olive oil may seem insignificant, but over months and years, it can contribute to better vascular health, improved lipid balance, more stable blood sugar levels, and reduced inflammation. These changes are not dramatic overnight transformations, but steady protective adjustments that support long-term well-being. If you are over 60 and concerned about diabetes, think of olive oil not as a simple cooking ingredient, but as part of a broader strategy to nourish your body intelligently. By replacing less healthy fats, moderating refined carbohydrates, and embracing whole foods, you create an internal environment that favors balance rather than spikes and crashes. The journey to better metabolic health after 60 does not require extreme diets or complicated supplements. Sometimes it begins with returning to simple, time-tested foods. Olive oil, with its rich history and growing scientific support, stands out as a powerful ally in the fight against diabetes. Through consistent, mindful use, it can help you protect your blood vessels, stabilize your blood sugar, and support a healthier, more resilient body in the years ahead.